Hello, good afternoon, everyone. Good afternoon, or good evening, or good morning, depending on your location. How are you guys doing? How are you guys doing? How are you guys doing? Welcome to today's program. How are you guys? How are you guys? Please indicate where you're watching from. Just Nalu, you're welcome. Welcome. Welcome to today's afternoon program. All right. Let me see your reactions. Okay, we shall be discussing. Let's just give. Let me just wait about 5 minutes. Let me see if if more, if more people will join the program, and then we'll just watch this program. I shall be discussing from the title of the video. What is the 4-2-1 rule in diabetic retinopathy? I have a lot of questions to answer. I don't know whether it's just to answer those questions, waiting for my attention, or because I have a couple of questions here. I have a couple of questions here to answer, but I want to make sure. Regina, you're welcome. How are you doing? I decided to discuss this topic today because I have a couple of questions. I have a couple of questions on retinopathy. You guys know what is retinopathy? We're talking about eye disease, diabetic eye. All right, but I have a couple of questions, and that is why I decided I'm going to do this topic this afternoon. The first I have, let me see how many questions on this topic. I have one. Let me see, 1, 2, 3, 4, 5 questions. I think I've answered this question before. I don't know why. I'm good with it. I got 5, 6. I have 6 questions here on this topic. Okay, Susan, you're welcome from South Africa. Okay, let me answer those questions before we go into today's topic. The 4-2-1 rule in diabetic retinopathy. You guys understand what is diabetic retinopathy? It's your diabetic eye. If you don't control your sugar level, then it is one of the complications. You might lose your sight if you do not control your sugar level. Okay. Now I have 6 questions here regarding this retinopathy, and I might as well answer the first question. I've answered this question before, but I don't know why I got it. let me go to that question. Just hold on, I need to clear some. Okay. Now, this is the first question I'm going to answer. All right. You say, I've answered this question when I discussed retinopathy, but I don't know why this question keep coming back. What are the stages of diabetic retinopathy? Okay, I did answer this question. We have 4 stages. Okay, there are 4 stages of diabetic retinopathy. Okay, what are the stages of diabetic retinopathy? If you're a diabetic, what are the stages you have to go through before you finally lose your eyesight or partially lose your eyesight? And I say there are 4 stages. We have 4 stages of diabetic retinopathy. The number one, the first stage is mild. Okay. This is stage 1. Okay. The question is, what are the stages of diabetic retinopathy? And then there are 4 stages. And then this is stage 1. Stage 1 is the mild non-proliferative retinopathy. That is the tiny blood vessels in the retina swells, and some may start to leak. So this is mild non-proliferative retinopathy. Okay, there are 4 stages. Now, let's go to this is stage 2. Okay, stage 2 is moderate. So from mild to moderate. Okay, from mild, this is stage 1. The question is, what are the stages of diabetic retinopathy? And I said there are 4 stages. This is stage 1. Stage 1 is mild. Okay, stage 1 is mild. Now, stage 2 is moderate. Okay, stage 2 is moderate. All right. And this is stage 3. All right. Stage 3, from mild to moderate to severe. Okay. When the retina can become damaged. Sorry about that. So what are the stages of diabetic retinopathy? I said the answer is 4. We have 4 stages. This is the 3rd stage. Okay. And then the final stage, which is the 4th stage. So it starts from mild to moderate to severe, and then the final one is when it become this is the final one. The stage 4 is the proliferative diabetic retinopathy. Okay. Okay. At this, from stage 3 to stage 4, you begin to lose your eyesight, either partial or total. But at this stage 4, it's when you lose your eyesight. Okay, it could be partial or it could be total. So stage 4 is the advanced stage. At this stage 4, you are more likely to lose your eyesight because of uncontrolled diabetics. All right, uncontrolled diabetics. So the answer to that first question, we have 4 stages, starting from mild to moderate to severe, and then to the proliferative retinopathy, which is the advanced stage. At that 4th stage, you are more or guaranteed likely to lose your eyesight. It could be total, loss of eyesight, your vision, or partial vision loss. All right. So I just want to rush. Let's go to number 2. Let's go to number 2 question. And then number 2 is what are the symptoms of diabetic retinopathy? What are the symptoms? I know I've discussed what are the symptoms of diabetic retinopathy. Okay, blurred vision is one symptom of retinopathy. You have blurred vision. The next one is you're having difficulty distinguishing colors. You find it very difficult to differentiate which color is this and that. All right. And then the next symptom is you are finding it very difficult to see at night. During the nighttime, your vision is very poor. You cannot see properly. All right. And then we have the floaters. Okay. You have floaters or a dark spot in your eye. Those are the symptoms of diabetic retinopathy: floaters or dark spot in your eye. Having difficulty seeing at night. During the nighttime, you cannot see properly, so your vision is limited. Now you have the blurry vision. Okay, you have difficulty differentiating between colors. So you find it very difficult to differentiate different type of colors. And again, loss of vision. Okay, at this stage, loss of vision. Either it could be total or it could be partial loss of vision. So those are the symptoms of diabetic retinopathy. What I'm going to repeat it again. What are the symptoms? Floaters or a dark spot in your eye. All right. Difficulty seeing at night. You cannot see properly at night. Your vision at night is limited, very poor. Okay. Blurred vision is one symptoms. And then difficulty differentiating between colors. When you see colors, you're going to find it difficult to know which color is this or that. And then your vision loss. These are the symptoms of diabetic retinopathy. There are 4 questions. I'm going to wait towards the end of the program. I'm going to answer those 4 questions. Let's go back to today's topic. Let's go back to today's topic. All right. What is the 4-2 rule in diabetic retinopathy? Okay. What is the 4-2-1 rule in diabetic retinopathy? First of all, you guys have to understand what is retinopathy. Retinopathy have to do with your eyesight. Like you have a diabetic feet, you also have your diabetic eye. And all those things are part of the complications of diabetics. If you fail to control your sugar levels over a period of time, or you are careless, you are not taking your treatment very seriously, and you keep allowing your sugar level to build up, then you might likely face the complications of damaging your nerves that are connected to your retina, and that is how gradually you start losing your eyesight. And eventually you lost your eyesight due to uncontrolled diabetes. Now, the 4-2-1 rule is a tool that doctors use to diagnose the severe cases of diabetic retinopathy. When doctors use these 4-2-1 rules, they use it mostly in the severe cases of diagnosing your retinopathy. Say, for instance, you go to your normal eye check, everything. You within yourself as a patient of diabetic patient, you know that you cannot see properly. You know that something is wrong with your eye. Now, you go to several eye examinations, they couldn't find anything. Now, this 4-2-1 rule is the one, they use it in most severe cases. They don't use it at the beginning, they use it at the severe case to diagnose retinopathy of an eye condition that is affecting people that live with diabetics. So now, once you understand that if you are not taking care of your sugar level, if you are not living according to the rules or according to the guidance of your doctors, know there are complications that comes along with uncontrolled diabetes. And I said, losing of your eyesight is one complications. Losing your arm or losing one of your leg is also one of the complications of diabetes. Losing your life is also a complication of diabetes, because eventually, if you're not controlling your diabetes, eventually it might be fatal and potent that you might eventually lose your life. So that is why you have to control your sugar level. Now, the retina, which is the thin tissue of the back of the eye, which is closest to the optic nerve, sends light and details in what your eye sees. That is what controls the central visions of your eyesight. Now, once the nerves connecting to your retina are getting roughed off or silently or gradually being damaged. Okay. In the beginning, you might not notice any symptoms. Okay. Like for instance, in the stage 1, when it is mild, you might not notice any symptoms in the early stage of diabetic retinopathy. Now, but if you know you're a diabetic, if you know you're a diabetic and you are, there are people that are something is distracting me, and I'm trying to, something is distracting me. I'm trying to focus. If you're a diabetic, there are people that are conscious of their health. They will know when something is wrong, and they can tell when they sense the symptoms in their body. Now, the early stage of retinopathy, you might not notice because it is mild. But you, as a diabetic patient, will know there's something wrong. There's something not adding up. And that is when you have to seek doctors to check why you are feeling that something is not right with you. Now, let me just deal with this. I'm trying to make sense of what you are saying, what you are asking me, but you are distracting me because I'm trying to make sense of what you are sending to me, but I cannot make sense of it. Can you see with one eye, or you cannot see with both of the eye? Can you just let me know? Are you short or long-sightedness? Are you okay? Let me hold on. You are distracting me because I'm reading what you are sending to me, but I can't figure it out. Can you see with both eyes? Yes or no? Nalu, you're welcome. Grace, you're welcome. Can you see with both eyes? Yes or no? Let's take it step by step. You can see with both eyes. Okay. Now, the next question, how far can you see? Can you see something that is far away from you, or you can see something that is closer to you? All right. You say you're using eyeglass. Now, when last did you go for your eye test? Okay, what you have to do, I will recommend you go back to your doctor to send it to an ophthalmologist, okay, to check your eye. The glass you are using, maybe you are using the wrong glasses, the eyeglass. You are not using the correct eyeglasses. Your eyeglasses must be the one that is medicated. When I say medicated, it's prescribed by your doctor. I don't know if you are listening to me, because what you are writing here, I believe you are listening to me. So maybe you are using the wrong eyeglass. That is why you can only see something that is closer to you. If you're having an issue with your eye, all right, and you're diabetes, you can't see something that is far, you have to go back to your doctor to retest your eye, and they prescribe the proper eyeglass for you that it can allow you to see something that is distance. Okay? Because your eye, the glasses that you use, you are being prescribed that glasses depending on your health at that particular time. So as time goes on, if you're not controlling your diabetes or your sugar levels and it gets worsens, then the distance at which you see, you might not see something that is very far away. You can only see something that is closer to you. You have to still go back to your doctor to retest your eye and see if you can see something that is very far away from you. If you cannot see it, then they will prescribe you a medicated eyeglass that can fit your eyesight. So at this time, you are using the wrong eyeglass. If the eyeglass you are using, you can't see, either you see something closer to you, or you cannot see closer something far to you, you still have to go back to your doctor to get the required, the normal eyeglass that is good for you. So now that you can only see something that is far, the eyeglass can only see something that is far, but you can't see something that is closer. Then you have to go back to, like for instance, you see this, my eyeglass is medicated. The one I'm using now is medicated. Okay, I can see without eyeglass. I can see, but I use combination of it. This eyeglass I'm using now, I can use it to see something that is far. I can use something that is closer to me. I can also use it to watch television, okay, even if it is very far. So it depends. So you have to go back to your doctor. If you are finding it very difficult to see properly, go back to your doctor to retest your eye, because the time you do that test, maybe you can see something that is closer to you, and that is why he prescribed you that particular eyeglass. But if circumstances changes that you cannot see something closer, you can only see something far, you have to go back to redo your eye, to redo the test. Then they are going to prescribe you the correct glasses for you to use. Okay. All right. Okay, I have to get back to what I was saying. All right, so let's go into this 4-2-1 rule. Okay, how do doctors use the 4-2-1 rule in severe? Let's answer that question. How do doctors use this 4-2-1 rule? Okay, how do doctors use the 4-2-1 rule in severe non-proliferative diabetic retinopathy? Okay, there are certain rules, there are certain things that have to apply for doctor to use this rule to diagnose your eye conditions. Okay, now the first thing is the 4 quadrants. Okay, the 4 quadrants of your retina have vessels with the severe bleeding. There's something we call the 4 quadrants. That is why it's called 4-2-1 rule. The 4 quadrants of your retina have a vessels with severe bleeding and tiny bulging called micronisms. When your 4 quadrants, the vessels in them are bleeding. When we say bleeding, they are leakage in it. Okay, so for instance, when you go for your eye test and you're looking into that stereogram, and you're looking into it, they can see the back of your head where the retina is located and see the vessels in there. Are there any leakage? Are there any bleeding? That is the 4 quadrants for them to use to diagnose whether you have an issue of your eyesight. Okay, then the 4 quadrants, they bring it down to 2 quadrants and then the 1 quadrant. That's what they call the 4-2-1 rule. They start with the 4 quadrants. If they check there is no bleeding on that one, they go to the 2 quadrants. Okay, then the 2 quadrants, they concentrate on the veins and the arteries that are connected to the retina to see if there's any bleeding or leakage in those areas. Okay, all right, so on those 2 or more quadrants have veins, which, when the section that are wider than the usuals, they check on those areas. I told you guys, nerves. There are some nerves that you cannot see with your naked eyes. Rather, you can see them with your microscopes. And those nerves are very tiny. So when they look at those, go to the 2 quadrants, they look at those veins and the nerves. Are they wider than the usuals when there's an inflammations? So now, if they rule out the four quadrants, there's nothing in there. They go to the 2 quadrants. The 2 quadrants, they concentrate on which is wider than usual. The veins, the nerves in there, which one is wider than usual. If there's nothing in there, then they go to the last one, which is the 1 quadrant. Okay, and they look at the blood vessels. So now they look at the first 4 quadrants. They look at the vessels, the vessels. If there's any severe bleeding on those areas, okay, and if there's any bulginess. If there's not in that area, they go to the 2 quadrants and look at the veins and the nerves and the arteries to see which one is wider than the usual ones, because most of the nerves are tiny. So if there's any inflammation, one is going to be bigger than the other. Now, if there's nothing in there, they go to the 1 quadrant. In that 1 quadrant, look at the blood vessels to see, is there anything that is inhibiting blood flowing into the retina? So they have to, each of these quadrants, they have to go to the 4 quadrants, 2 quadrants, and 1 quadrant to diagnose if you are having diabetic retinopathy or not. And all those things have to do with this. If there's any bleeding or linkage in all those things, the vessels, the veins, the blood vessels, the nerves, they check all those things to see, okay, we see there's a links in there, bleeding in there, there's a bleeding in there. Okay, fine. There's a possibility you are having a retinopathy. They go to the second section, which is the 2 quadrant, and see. Let's look at the veins and the arteries to see which one is more wider than unusual, because they are not supposed to be wider, they're supposed to be in the tiny sections. And if they can identify that 1 or 2 veins in there are wider than usual, there's a possibility you're having a diabetic retinopathy. Then they go to the last one, which is the 1 quadrant. In 1 quadrant, they concentrate on the blood vessels. Is there anything that is inhibiting the blood reaching the retina? So that is how doctors use the 4-2-1 rule to diagnose if you have retinopathy. Okay, so if you have at least 2 out of these 3, then you have a severe MPDR of retinopathy. Let's look at Lil. How are you? Grace, you're welcome. Do we have any question? Do we have any question? Oh, sorry. I'll be right back. I'll be right back. All right. Do you have any question? Can you guys hear me? Because everywhere is silent. Can you guys hear me? I think I'm having an issue with my. I'm having an issue. I hope I'm not having an issue with anything here. All right. If I want to make sure if we have any question. Who is still here? Because I could see everywhere is quiet. Everywhere is quiet. Nobody's asking any question. All right. I'm going to answer your questions. Do you have any question? Am I connected? Because it's like everybody is not here. All right. Now, once you are diagnosed with retinopathy, okay, using the 4-2-1 rule, okay, now you need to have a regular dilated eye exam. You have to have regular dilated eye exams to check on the condition of the progression and lower your chance of vision loss. So if you are diagnosed using the 4-2-1 rule that you have a severe retinopathy, then continuous dilated eye exam is necessary to make sure you check the condition of the progression and then also start treatment to lower the chances of you losing your vision. That is why it is important. If you're a diabetic, you must every year go for an eye exam. Okay, there are some people that goes on their own every 6 months, some go every year. Everything depends on the severity of your diabetics treatment. There are people that control their sugar level, so they don't need to go every 6 months. They have to go every year. But if you are finding it very difficult to control your sugar level and then you are struggling, then you are at a high risk of losing your eyesight. So they have to scale it every 6 months to see the progression of your retinopathy, to see, is it getting worse? Is there any leakage, any bleeding in the retina? And then they could delay it, stop it, okay, and then start treatment. So that is why you must, as a diabetes, always go to check on your eye every year. It is mandatory. You go on an eye examination every year to do an eye examination to make sure everything is in order. It is not a choice. You have to go every year. But everything depends on your doctor who is treating you to see, okay, do you need every 6 months or every year? All right. Do you guys anybody have any question? Because I have to let me. Anybody has any question? Let me answer one of the questions and then. Do you guys have any question? Something is wrong with my system today. Something is wrong with my system. There's something wrong. I have to figure out what is wrong. I don't know what is going on throughout today. Something is wrong. I have to reboot. Something is wrong with my system. I have to reboot and get back online. I'm going to reboot. So I have to reboot and come back. Something is wrong with my system. I can tell. I'll have to reboot and come back. All right.